Hi everyone, I just wanted to hop on here and talk a little bit about some lipedema signs and symptoms, as well as if you are Canadian and very likely American, and I know some stuff about UK diagnosis as well, just from friends. I wanted to share how you can go about getting a diagnosis, and then I'll also share where it can be really important to get a diagnosis and where it might not necessarily need to be your first priority, because there are several different conservative treatments that you can begin right away and you don't need to wait for a diagnosis in order to do that. So we'll start a little bit with some signs and symptoms. So if you are someone who has always had a disproportionately larger lower half than upper half, then you may be someone who could potentially have lipedema. My entire life, my legs were big, my waist was small, and finding pants was a challenge. So that if this is something that you can relate to, then you may be someone who has lipedema. Another really weird but common side effect is easily bruising, or almost mysterious bruises. For most of my married life, my husband would always be like, "Where'd that bruise come from?" And I wouldn't know, because you bruise so easily, and it could be something as simple as you're going to sit down on the couch and you accidentally, or you maybe don't even notice, you hit your thigh on the side of the couch and a bruise could form. For me, sometimes I would have big bruises. Often I would just have really little bruises, almost like the size of grapes, all over my legs, especially once I had kids and we were playing different games and being active. So easily bruising can be a sign. Some of the theories around that is because there is a larger quantity of fat on your lower limbs, then there's more veins and stuff that develop in order to feed all of that fat. And so maybe that is a potential reason for the easily bruising. So I really bruise like a peach. Okay, another side effect is, or another symptom is pain. So I've heard and met other women with lipedema that do not express having pain. But for me, it could be something as simple as like my child putting their hand on my thigh and I would flinch a bit, or a cat jumping on my lap, I would flinch, because the pain was just sort of constant. It's challenging to describe exactly what it's like, because for so long it was my normal, so I didn't even necessarily think about the fact that I had pain in my legs. So if this is something that you experience, you may have lipedema. Lipedema is different from lymphedema. Lymphedema is there's been some damage to your lymphatic system and then it causes swelling. I don't know a ton about lymphedema, but often it's not symmetrical. So often people with lymphedema will experience like one swollen leg and the other leg may be of normal size. With lipedema though, if left untreated and it continues to progress, it can then cause damage to your lymphatic system and cause lymphedema. So I think they even call it lipolymphedema. So it's lipedema with lymphedema as well. Okay, some other side effects, brain fog. I found out that brain fog was very likely a result of the fact that my lymphatic system was so taxed, it was unable to get rid of all of the toxins in my body at the rate in which it needed to. So that caused me some brain fog. Okay, what are some other symptoms that you may be able to relate to? So I didn't have the cuffing, but a lot of people, it will almost look like there's an elastic around their ankle because the fat accumulates on the leg and then the foot appears quite normal. So my foot appeared quite normal, and it was just, I had cankles. So it was just like just basically column-like legs is another symptom of lipedema. Let me just try and think of maybe some quirky symptoms. I have a video that has like unusual signs and symptoms of lipedema, so go and check that out. But what I also want to talk about here is treatment. So treatment, you can start treatment today. So here's one of the first things I recommend to people who figure out or come to the realization that they have lipedema. Drink tons of water to support your lymphatic system. Yes, you may pee often, but this is going to help flush things out. The second thing I recommend to start immediately is compression leggings. If you're in Canada like me, you do require a prescription for the compression that's recommended, which is 20 to 30 milligrams. Often people do recommend custom-made compressions, but these can be very expensive. So this isn't something I say, go do this immediately. But if any kind of compression that you can get your hands on is gonna be good. So even if it's that lower 15 to 20 milligram pressure, that is going to help move the lymph fluid so that it's not storing and accumulating and potentially causing more lipedema growth, fat growth. So the thing about lipedema is it often is triggered around different hormonal changes in our life. So puberty, pregnancy, perimenopause, menopause. So this is when a lot of women will see rapid growth. So you may live with like bigger legs for the large majority of your life, and then all of a sudden you begin to gain weight on your legs, like at an uncontrollable rate. You haven't changed anything about your diet, and you're like, what is going on? Look into lipedema and whether or not this is something that you may have. So another conservative treatment is gonna be figuring out your hormones and supporting your hormones so that you prevent future lipedema growth. This is gonna be something you're gonna wanna discuss with your doctor, possibly get a referral to a gynecologist or an OB, someone who specializes in hormones. It's more challenging to get a referral to like an endocrinologist, but if you're in a different country other than Canada, that may be a possibility. I get a lot of questions also asking about how to get a diagnosis. So a lot of women within this community have diagnosed themselves, begun treatment, and then sought out further medical advice. Here in Canada, lipedema is most often recognized by vascular surgeons because a lot of women with lipedema also have vascular disease or venous insufficiency. So they'll see, so another sign and symptom can be lots of varicose veins, venous insufficiency, maybe your saphenous vein, the valve not working. And the theory is, this isn't a for sure cause, is that because the system is so taxed and there's such an accumulation of fat, as well as a lot of women with lipedema have leaky veins and even gut, and this can contribute to an overtaxed, overworked lymphatic system. So vascular surgeons have become more and more familiar with this here in Ontario anyways. Both vascular surgeons that I saw were both aware, and so asking for a referral to one could be beneficial to you. I do believe a lot of women with lipedema may have venous insufficiency, but it may not be as visible because of the fat accumulation on their legs. This is just a theory of mine, it's not a fact. So asking to get a Doppler ultrasound on your veins could be an opportunity for you to discover maybe if you have venous insufficiency, as well as in Ontario then be able to get an appointment with a vascular surgeon to discuss the fact that you may have lipedema and also venous insufficiency. So those are the doctors that are most familiar that I am aware of. My nurse practitioner was familiar with lipedema, but didn't know about the more aggressive treatments like water-assisted liposuction and so on. In Canada, it was, would you like me to make a referral to a dietitian? So, which I don't know, I need to reach out to some dietitians to find out if they have much knowledge of lipedema, because in terms of the programming for dietitians in Ontario, I'm not sure how specialized it would be. Okay, I also wanted to talk about, so I talked about drinking lots of water to help flush out your lymphatic system, compression leggings to help with that lymph flow, manual lymphatic drainage, or even just cream your body every day. And this can be like a gentle massage and get things moving, as well as legs up the wall, I find is really helpful with getting rid of any fluid retention through my legs. These are all things that can help you. Movement also. Move your body as much as you can. I know some women who have later stages of lipedema find movement challenging. So I would suggest becoming creative, even if you're seated in a chair and using some weights and maybe even moving your legs or utilizing a vibration plate, because it's thought that this will help to loosen up your lymphatic fluid so that it can flow properly. Then you can also go and get manual lymphatic massage. So manual lymphatic drainage to assist you with getting your lymphatic system up and going again. And then I want to talk about something that I did that when I learned that this was possible, I could not believe it. I was actually incredibly excited at the thought that I could potentially get rid of the lipedema in my legs. Water-assisted liposuction. This is a lymph sparing liposuction, so it's a much gentler procedure so as not to trade one challenge for another, because you would not want to trade your lipedema for lymphedema, because the experiences can be similar. They're not completely similar, but it could be just as detrimental to you. So I opted for a water-assisted liposuction because it was lymph sparing. There are no Canadian surgeons that specialize in lipedema that are doing this. There are a couple of plastic surgeons that advertise lipedema removal surgery, but I do know it's not water-assisted liposuction because I did look into it. There may be some that are coming about, or I guess there could be some that I haven't heard about. I'm speaking specifically about the Ontario region. The European countries are much more versed in lipedema. They've studied it more. A regular doctor tends to be able to recognize it and make appropriate referrals. And they even provide supports under their whatever their medical system is for women with lipedema. Here in Ontario, they do not. If you want compression stockings, if you have benefits through your work, you may be able to have those covered, but if you do not, it's not something that is covered. So I began to do research about where there were lipedema specialists who were performing lymph sparing liposuction. And I came to realize there were a lot of really, really great researchers and doctors doing this in Germany and Spain, Austria. I'm trying to think of what other countries where there were quite a few. And then I found my surgeon who was in Poland. There is also a very good doctor in Florida. I want to say near Orlando, who does do a lipedema removal surgery, awake. He has amazing results, especially aesthetically. But I know a few women who have had surgery with him and their pain is completely gone. I did get a quote from that surgeon in the US, His name's Dr. Sooo, and it was one where we were gonna have to do it in stages. Whereas I had a quote from a German doctor as well as a Polish doctor, and I really did want a female surgeon. That was a deciding factor for me. There are more than one female surgeon, so I definitely recommend doing your due diligence in terms of your research. But I was able to, the surgeon I spoke with, Dr. Nowicka, her clinic is called Novaline, and she is in Poland. She thought she could do, because I was maybe stage 1, stage 2, 360 legs in one surgery. And so the thought of being able to have it all done in one surgery and then have that one recovery period was very appealing to me. So that's what I did. I did it and I feel fantastic. I had the surgery August 28th of 2023. So I'm coming up like 10 months this month in terms of post-recovery. They do call it the healing year. So it's something where you have to be patient in terms of your recovery, but I feel incredible. I do still continue conservative therapies. So compression leggings I wear every day. I drink tons of water with lemon, I definitely do. I take a bunch of different supplements as well. And I have been able to manage my hormones. These were all things I wanted to do before the surgery, because even a surgery can cause a hormonal fluctuation in your body. So I didn't want to go and have surgery and then my hormones get thrown out of whack and then have a large lipedema growth. Okay, so I wanted to share all of these things with you today because this was all information that I had to dig for, and I want to share it freely with you so that you can go and do the research for yourself and figure out what's going to be best for you. But most importantly, if you do think you have lipedema, there are things that you can start right this minute. So go get a giant glass of water. Begin to pay attention to the foods that maybe cause discomfort or inflammation in your body, and then eat more of the foods that make you feel good, energized, and really support your wellness. That is it for today. I hope you guys have a wonderful day. Feel free to leave any questions or comments below. If you're from a different country and there was a different type of doctor that diagnosed you, feel free to leave that in the comments so that other people can know as well. And I will just say, have a fabulous day. Bye, guys.